All right, we'll go ahead and get started. Well, good evening, everyone. Thank you for joining us. This is the COVID-19 Town Hall for school staff and families, hosted by ThriveKids Student Wellness from Children's Hospital New Orleans. We're hosting this today in partnership with the Department of Education, Jefferson Parish Schools, and New Orleans Public Schools. So we appreciate the opportunity to get together with you tonight and just talk about COVID-19 in the school environment. My name is Kimberly Buckingham. I'm the manager over the ThriveKids program, and I will be our moderator for the night. An overview of our discussion tonight will look like just starting off with some introductions. We'll review which panelists will be participating across our partnership board that's on tonight. We'll touch on some resources that are available to everybody on the call. And then we'll review the latest COVID-19 guidance for schools and a decision tree that the Department of Health and Children's Hospital has put together that's available on our website that schools may take reference point to. And then we'll lead into some comments that our panelists each will contribute. And then we'll go into an open Q&A discussion based on the questions that were pre-submitted leading up to the webinar tonight. So I'll just provide some brief introductions, and then we'll hear from each of these panelists in a few moments. From Children's Hospital New Orleans, we have Dr. Leron Finger. He's our Chief Quality Officer and COVID-19 expert. From the Department of Education, we have Meredith McGovern, the Executive Director, Pathway Initiatives and Readiness Support. And from New Orleans Public Schools, we have Tiffany Delcourt, our Chief Operations Officer, the Chief Operations Officer. And from Jefferson Parish Schools, we have Daphne Walker, the Director of Health Services. So thank you to all of you for joining us tonight. We appreciate everything that you're doing and what you're going to contribute to our discussion. So just to remind everyone on the call, we do have resources that we've put together that are accessible to everybody across the state. We have a hotline that's the ThriveKids hotline at Children's Hospital New Orleans. That's 504-837-7760. This number can be leveraged by both school staff and by families. Statewide, you can access on-demand COVID-19 guidance by a nurse team that's 7 days a week. And you can also access 24/7 pediatric video visits or have a video visit with an adult physician as well. So those are great resources for the state. Locally, we also have the ability to schedule vaccines and testing. So that's a great number to reach out to. On the Children's Hospital New Orleans website, we also have all of our recorded town halls, downloadable materials, and of course the decision tree that we're about to review together. And then each panelist that will be on today also has resources that you can certainly access online and have an opportunity to send additional questions to. So I'll go ahead and open up the floor to Dr. Leron Finger to just start off with some high-level COVID-19 guidance, golden rules, and then we'll touch on the school decision tree as well. So Dr. Finger.
Thank you, Kimberly, and welcome to everyone in the audience. Thank you. I know there's educators and parents on the phone, and I just want to thank everyone for the collaborative effort that we've done really over the past year and a half to do great with getting our kids educated through a combo of in-person and virtual education. The golden rules that we discussed throughout the last year with the Department of Education and schools across the state were relatively simple: masking, washing your hands, and distancing, and perhaps most importantly, and here highlighted in number 4, staying home if you're sick. Those rules haven't changed. There have been some slight modifications moving into the next school year for how many feet we distance and what is defined specifically as a close contact. But by and large, the rules are the same. And you'll hear about this a little bit more through the discussion. We really do strongly believe that a safe return to in-person education for our students, our families, and all of our educational team members can be achieved if we stick to these operational guidelines when on our K-12 campuses across the state.
Thanks, Dr. Finger. And we'll go ahead and move into our decision tree. So if you want to just provide a very high-level review, we can always flick back to this if there's any scenario-based questions.
Sure. So trying to get the compendium of information from the CDC and the Louisiana Office of Public Health onto what I like to think visually is an easy to follow flow chart. We've got our flow chart put together here for how to respond to a individual who has symptoms and whether or not they're on the school campus. So the first thing that we need to do, similar to last year, is either get tested for COVID or get seen by a healthcare provider. In the current state of high percent positivity across the state, we have a low threshold for getting COVID tests on folks who have any symptoms. But if they do get evaluated by a healthcare provider, that healthcare provider does have the ability to provide an alternate diagnosis and determine that a COVID test is not indicated. But the student or team member should still stay home until symptoms improve and they're fever-free for a 24-hour period. If they do get a COVID test, if it's positive, we follow the same isolation criteria that we have for the past 17 months, which is staying home until you're 10 days since the first symptom appeared, or you had your first test, or if you had the asymptomatic, had the test done, your symptoms have improved, and you're fever-free for 24 hours. That's 10 days at a minimum of isolation. If you're negative, you stay home until your symptoms have improved, just like with any other viral illness. Our recommendation is that that test be a molecular test, even if an antigen test is negative for a symptomatic individual. Recognizing that in many areas across the state right now, it's a challenge to obtain those molecular tests. It nevertheless remains our recommendation that that test be a molecular test, which provides a higher level of accuracy for symptomatic individuals. And then that box in the middle, if there's no test result been confirmed or been evaluated by a healthcare provider within 48 hours, we recommend that that child or team member be treated as a presumptive positive. I think this is where it gets challenging, and we rely on collaboration with our schools and our parent community to try and do the right thing in an effort to keep all students and team members safe on our campuses across the state. Next slide, Kimberly. So this is sort of our new and updated algorithm, which incorporates new definitions for close contacts. The state of Louisiana, if you're identified as a close contact, which is defined as off of a school campus, being within 6 feet of someone with COVID for a cumulative total of 15 minutes or more over a 24-hour period for up to 2 days before the case was identified. The state of Louisiana is recommending that a close contact seek a COVID test as soon as possible following notification of them being a close contact. That doesn't mean you need to run out at midnight to get the test. It means in the next day or two, if possible, and testing is available in your community, to get that test. While you're waiting for that test, if it's positive, you follow the symptomatic decision tree. If it's negative, if you're a close contact, you're going to be in quarantine regardless. The only reason you don't have to quarantine is look at that big blue box at the top. If you're fully vaccinated, or if both the positive individual and the contact were engaged in consistent and correct use of well-fitting masks and were more than 3 feet apart. But that only applies to students on a K through 12 campus. It doesn't apply to if the two kids are at a party on a Saturday night. It's in this classroom. Regardless, those individuals still need a mask for a full 14 days, follow the exposure, and must obviously isolate and test if symptoms develop. During the quarantine, if a school system has chosen an option to decrease the duration of quarantine from 14 days to either 7 days or 10 days, it's required in order to shorten that quarantine to 7 days to get a COVID test 5 to 7 days after the exposure. Not all school systems are choosing to do this at this time. I know that Orleans Parish at this time is choosing to follow the 14-day quarantine period. In addition, they're not applying the rule for the 3 feet and masking. And I think Tiffany will allude to this more specifically. Schools are allowed to adopt these to meet their student needs and team member needs, especially what's going on in their community. So that's reasonable. These are the bare minimum. So, and then finally, for those kids in the blue box who are not quarantining because of one of those reasons, it's recommended but not required that they repeat that COVID-19 test 5 to 7 days post-exposure. Those folks do not need to wait for that negative test to come back and quarantine while they're waiting for it. They can remain in school while they're waiting for it. So Kimberly, I know that was a very, very high level review, but essentially what this algorithm does is take into account all the permutations and put it on sort of one color-coded flow chart to follow. Happy to answer specific questions when we get to the Q&A.
Great, thank you, Dr. Finger. I thought it was a really good point that you made about how schools and school districts may choose to adopt this with certain nuances based on what you mentioned in that gray box there. So I appreciate you pointing that out. And just to call attention to everybody on the webinar, please feel free to submit any questions into the chat. I'll be the only one that can see those questions because I fielded a lot of questions beforehand. So if there's anything new on there, then we'll make a point to address it during our Q&A. All right, so thanks, Dr. Finger, for starting us off. I'm going to give every panelist an opportunity to step in and just share some opening commentary or express any encouragement or key nuances of what's going on in their school district. So Meredith, why don't we go ahead and start with you with the Department of Education. We're continuously grateful for your collaboration and appreciate you making time to be on tonight.
Yeah, absolutely. Thanks for having me, Kimberly. At the Louisiana Department of Education, we have partnered with Children's Hospital and the Louisiana Department of Health to create a series of guidelines of best practices for our school systems, not only last year, but also this year. One of the lessons we learned last year was that our students performed better and learned better when they were in their in an in-classroom environment in person. So our goal for this year is to create an environment where our students are safe enough to stay in school and continue learning in person. And I think that Dr. Finger did a great job of pointing out how every district, it's going to look a little different across the state. And I think that's one of the benefits of our Ready to Achieve guidance, is that we are able to give our schools the flexibility to decide what's best for them whenever it comes to instances like quarantine times and other scheduling issues that they may or may not have. So once again, we are incredibly grateful for y'all's partnership, and I will stay on the line to field any operational questions.
Thank you, Meredith. Appreciate you. All right, and next from New Orleans Public Schools, we have Tiffany Delcourt. Tiffany, wanted to open it up for you and also appreciate you for taking the time to come in and talk with us tonight.
Absolutely. Thank you. So happy to be here, and especially with so many wonderful people that have made our school year last year and this year going to be successful. We're thankful for the Department of Education, who provided us a really great concrete basis for our guidances, and then also the work of Dr. Finger and our own medical advisors who helped us tailor that guidance to our own kind of local experience. So at NOLA Public Schools, we're committed to in-person learning for our schools this year, as we know our students learn best while in the classroom, but also not sacrificing the safety of our staff and students. And so we have two tools that we didn't have last year that really help us do that, being vaccinations and testing. And when we talk more about NOLA Public Schools, I'll share more about how we're utilizing those tools this school year. But today, I think, is an exciting day. This is our first day of having all schools in session for the start of the school year. And it's our first time of having every child in person in our school buildings for the first time in nearly a year and a half. And that's momentous and exciting. And so it's a really monumental day for us at NOLA Public Schools. Thank you.
Tiffany, do you want to take time going through a couple of the next slides related to NOLA Public Schools, or is that enough for the commentary at this point in time?
Oh, got it. I wasn't sure if that was happening now or later. So as I just said, we're committed to in-person learning. This has been recommended by every medical professional agency that we follow, including the American Academy of Pediatrics, the Center for Disease Control, the Louisiana Department of Health, our own City of New Orleans Health Department, and countless other entities. We also do have a distance learning accommodation for our students who have a specific medical condition or medical vulnerability. That accommodation form is available on our website. And you can take that to your family physician to have that filled out if you have a student with a medical vulnerability. So we are offering distance learning accommodations for those who are medically vulnerable. Like I said, what's different this school year than last school year is we have two unbelievable tools against COVID-19. One being vaccinations, which is the ultimate tool against this disease, and secondly being testing. And I'll talk about our progress and our steps to make sure that we're having and implementing those in all of our schools this school year. So like I said, today is the first day of having all of our schools back in session for the start of this school year. It's also the first time of having all of our students back since March of 2020, which is truly amazing. And though, you know, there's lots of concerns about face masks in schools and other things, our students know how to do this. This does not bother them. And so this is just some examples of our students, you know, knowing what to do, following what is now their normal business as usual, and they know how to conduct themselves in schools, and they are COVID-19 prepared. So one of those ultimate tools against COVID-19 is vaccinations. So over the summer, with our schools and our healthcare partners, including Children's Hospital, Ochsner Health Systems, Crescent Care, and Core Response, we were able to vaccinate 1,000 students over this summer through mobile vaccination events and sites. We also just received, or one of our major healthcare entities, Crescent Care, just received a $90,000 grant from the Greater New Orleans Foundation, the United Way, and Entergy New Orleans to provide $90,000 to keep these fall mobile vaccination efforts ongoing, especially as we prepare for those 2 and 11-year-olds to hopefully become eligible later this winter. And so also all of our mobile vaccination sites and events and dates are available on our website. And these are open to all of our schools, so you can see where we will have mobile vaccination efforts and programs at your student's school. You can see that schedule on our website. Also for testing, we know that not all of our students are eligible for the vaccine, and so we protect them with mandatory masking. NOLA Public Schools put in the requirement for face masks on July 23rd, a few weeks before the governor. So we were anticipating this as we knew it was the way to best protect our students, especially those who are ineligible for vaccinations. And secondly is making sure that we're routinely testing our students and staff for COVID-19. We started by the first day of school, once our first school was in session in August, to make sure that we had ongoing testing in our schools. In our first week of operation, we performed 500 tests. Last week, we doubled that, and we performed 1,000 tests at our school sites last week. What I'd also say is across our schools, in those 1,000 tests performed last week, we had a 2% positive test rate, which is really amazing and really shows the good work that our staff and our families are doing by keeping those students who feel ill at home and not sending them to school. We also have additional walk-up testing available, which started this week. Every Tuesday and every Friday, we'll have walk-up testing available for anyone in our school community and our greater community, where you can walk up and get your test. I got a test yesterday, and I just got my results 5 minutes ago while I was waiting for this panel presentation. So our results are coming in quick, and they are PCR molecular test. Also, starting in September, we will be providing weekly testing to our students and staff at every school at NOLA Public Schools. This is being provided by the Louisiana Department of Health. We'll be one of the largest school districts performing and participating in this program. We have 90 school sites that will participate, and we'll get started with this program on August 30th. So I just kind of wanted to go over all of the information, documentation, and transparency NOLA Public Schools has related to our COVID-19 response. You can see our COVID-19 protocols and procedures on our COVID care guidance, which is available on our website. We also are one of the only school districts in the state that publicly report our number of active cases and quarantines in our school system. And we report that information every Monday at 4 p.m. and you can see it on our website. I also spoke about our mobile vaccination schedules, which we're going to continue to update. We have our August schedule up, and we're starting to fill in our September schedule for vaccinations. And we also have a host of other community resources that we want to make everybody knowledgeable about. but you can find all of this information at nolapublicschools.com. Again, we really challenge ourselves to be one of the most transparent school districts in the state when it comes to sharing this information and our progress and our response. And we're excited to be here today, and I'll be looking through the questions as Kimberly points them our way. Thank you.
Thank you, Tiffany. Really appreciate you providing this content and reviewing all of that. All right, next up from Jefferson Parish Schools, we have Daphne Walker, who we're honored to be collaborating with and is a nurse herself by practice and training. So Daphne, I'll open the floor up to you to see if there's anything that you would like to share before we circle back to Dr. Finger and get into our Q&A.
Thanks, Kimberly. I appreciate the opportunity to be able to speak this afternoon. Just to let you know a little bit about who Jefferson Parish Schools are. We are currently the largest and most diverse school system in Louisiana. We're the 98th largest in the United States of America. We have about 50,000 students in our district and 80 schools. 75 of those are public and 5 are charter, and approximately 6,400 employees right now. Right now, we have our Start Strong Jefferson plan, which is our mitigation plan for COVID-19. That plan can be found on our website, which is www.jpschools.org. Of course, we have a wonderful team of nurses that are assigned to every one of our schools in our district, but we're not the medical experts. So that's why we collaborate with wonderful partners like LCMC, the Department of Education, the Department of Health, and of course, the CDC partners. We meet with our partners weekly and more frequently as needed to discuss mitigation strategies. So we are currently mandating masking in all of our schools. And in addition, of course, enforcing physical distancing in our classrooms and areas in the district, and frequent hand washing, and some of the most common mitigation strategies. We also are going to be offering this fall, right after Labor Day, COVID Q testing in every school site. That will be for asymptomatic and symptomatic persons with COVID-19. So the results will be available in 20 minutes once the testing is done, and we're hiring CNAs to be able to provide that testing during the school day so that it's available during school hours to both students and staff. And of course, vaccinations are an important part of our strategy. So we've been working with 4 different partners. Last year, we were able to vaccinate 2,000 employees, and we're continuing to provide vaccinations throughout the year to our students that are eligible for those vaccinations. And then, of course, we opened on August 31st, 2020 for in-person instruction and stayed open all year, as we have done. Schools opened on August 9th this year to all of our students. We are currently offering the immunizations and the testing starting right after Labor Day.
Excellent, Daphne. Thank you so much for all of your hard work as well. Is there anything else left that you'd like to share for the moment?
Not at this time.
Excellent. Thank you so much. All that's excellent information. Great. Well, why don't we go ahead and move off of our panelist commentary, and we're going to move into our Q&A discussion with our panelist team. And Dr. Finger, I'll let you kick this off with any comments you might have in response to our wonderful partners that just commented on what they're doing in schools. And if you have anything you just want to share before we dive into questions.
No, I appreciate the commentary from Meredith, Tiffany, and Daphne. Thank you. It's illustrative about how this school year is going to be similar to last year, which is a partnership. It's not one person or group of people making rules. It's a partnership to really engage in shared responsibility to maximize the safety of our students, our educators, and everyone's families. I think it's also important to look back at some of the lessons from last year, where with a similar approach, we were able, by and large, to keep the spread of COVID-19 on school campuses to not zero, but minimal, and through close attention through the operations of our school partners to guidelines. And yes, I see some of the questions in the chat. Everything is not always perfect, but all of these are layers in the mitigation process, and trying to do them all amplify one another, which is why we choose not to do one thing and not another. So I'm hoping that I see a lot of questions popping up in the chat. I'm hoping that Kimberly is able to address many of them, and the appropriate person on the panel will make every attempt to answer them honestly and as full as we can. So Kimberly, I'll hand it back over to you and your team as you sort through all the questions.
Okay, great. Thank you. And so I have a long list of questions that were pre-submitted, and most of the questions that have come through the chat seem to be covered by those, but we'll make sure to review that as we go along. And I will target these questions toward who I think the best recipient may be for them. A large amount of them, Dr. Finger, seem like they're going to be directed toward you. That being said, to all the panelists that are on today, please feel free to hop in and just kind of inject if something isn't directed particularly at you that you feel like would be great to comment on, either from a Department of Education statewide standpoint or New Orleans Public Schools or Jefferson Parish. So Dr. Finger, why don't we go ahead and just start off with talking about COVID-19 as a disease itself. There's a lot of confusion around what the difference is between last year's dominant strain and the Delta variant, and particularly how the symptoms might show up differently in kids. So can you just kind of take that from the top and give us a little bit of a general understanding there?
Sure. The symptoms are actually quite similar to what you might experience with many other viral diseases that affect primarily the respiratory tract. Cough, runny nose, and then a subset of patients across all age groups get slightly more sick, and some of them do need to come to the hospital, Kimberly. The challenge with the Delta variant over the last 6 weeks is that it's more contagious. So if more people have the disease, more people end up in the hospital. And that's what we've seen over the last sort of 4 to 6 weeks, especially in states that have lower vaccination rates overall.
And how are young babies particularly affected by COVID, maybe differently than older children?
Again, they're not particularly affected any differently at all. I think primarily in children, this appears to be a single system disease, meaning that it affects the respiratory tract. And again, the most mild form is a runny nose and mild cough. And if there's a subset of patients across all age groups who can get more ill.
Okay. Thank you. And then we did have someone reach out and ask around a breastfeeding mother if they should be concerned if to get vaccinated, or if they are vaccinated around catching it. Can you just talk about that?
Sure, we can bucket all the vaccination questions together, but specifically, I think strong proponent of vaccination. It's one of the most, our vaccines that are currently available have been one of the most tested healthcare products available. And I think in 5 to 10 years, we'll look back at them and they will be seen as one of the safest vaccines ever manufactured. In addition to the safety profile, the benefit for preventing severe disease due to COVID-19 is unbelievable. And, strong proponent of everyone who is eligible getting it once they are eligible to get it.
Do you have, while we're talking about vaccines, we'll just kind of go down that question list. Do you have any sense of when vaccines for kids younger than age 12 may be approved?
Yeah, I think it will be available as early as the middle of October and as late as by the end of this calendar year is what we're hearing from the federal authorities who are reviewing that data right now.
Okay, and does that involve anything like boosters or having to refresh individuals that may have already had a vaccine?
That's independent. So we're talking first of all about the 5 to 11-year-olds. And I think probably many people on this call saw the announcement that came today allowing for a third dose of an mRNA vaccine, which is either a Pfizer or Moderna, 8 months after you have received the second dose of that 2-dose series. So that's separate from the 5 to 11-year-old age group, Kimberly, but for everyone else.
Okay, great. Thank you for that clarification. And then can you talk about the difference in how the disease may be experienced by someone that's vaccinated or not vaccinated? That's a very general question. We can get more specific in the scenarios if we need to.
Sure, I think I highlighted it previously, but vaccination prevents you from getting severe disease. It almost certainly prevents you from getting disease for a period of 4 to 8 months. We don't know exactly. But even if you do develop COVID-19 in that time frame and you've been vaccinated, you have a much lower likelihood of getting severely ill than an individual who's not vaccinated. Right now, approximately 90% of the patients who are admitted to hospitals across the state of Louisiana due to COVID-19 are unvaccinated.
Thank you. And then I know you mentioned this earlier on the decision tree, but if you're an asymptomatic close contact, you don't have to quarantine if you're vaccinated, correct?
That is correct.
Okay, great. Thank you for clarifying that again. And then just in general, do you have, what suggestions and encouragement do you have to guide parents and school staff members on how to reassure children as we work our way through this pandemic?
No, I think that's a great question. I'd be interested to see if either Tiffany or Daphne have anything from their perspective. But I think at this point, kids are used to wearing masks. This has become weirdly normalized for them over the last 18 months, and they can exist with it. So I think ensuring that they have that structure during the school day and understanding what it means when there's a close contact, which will undoubtedly happen at schools. That's what the close contact process has been created for, to reassure them and be honest with them about what this is. I think a lot of folks early on framed COVID as it started in March in North America. When is it going to end? I think we need to reframe that as how are we going to learn how to coexist with COVID-19 in a way that allows us to return to our daily lives like we're doing here through this call in an effort to get back to education and make sure we maximize the safety of our students, our families, and our educator teams. Tiffany?
Yeah, the only thing I would add is, what's different this year is we learned a lot about students performing better when they're in person, obviously with academically. And we want to make sure that we don't lose those really precious and important milestones for the academics, especially in our youngest students. Also, our schools have a lot of resources regarding COVID. They have site-based testing once a week that parents can access if they're signing the consent forms for those testing, those mobile vaccination sites. So I think it's make sure you understand what resources are available to parents and family, not just your student, but you as well. When it comes to COVID-19, there are lots of resources around testing that families can also take advantage of, not just the enrolled student, and also those vaccination events and efforts. So I think there's a lot of resources at the school. And so just make sure you're knowledgeable at what those are and that you're accessing them, because it keeps us all in school. It keeps our students on track, which is what we're really focusing on this year.
Great, thanks, Tiffany. I'm going to go ahead and transition over to masking. There's a good amount of questions about that. Can we just refresh, how does masking help us stop the transmission of the disease in general? Excuse me.
Sure. So masking, and when done appropriately, I saw one of the questions about how to wear it, and it's obviously over nose and mouth. I'm not going to show you guys that. I know everyone on this call knows that. So it keeps people around you safe, and it keeps you safe from particles that might exist in the air. And again, it's not foolproof. It's not 100%. But what we learned last year is that when it's done consistently and correctly in an environment like a school, it massively decreases the amount of COVID-19 spread on those school campuses. We've got studies from not just the United States, but other countries who have been able to publish this. And it really is the primary mitigating factor that we have to focus on school campuses.
So in situations where students might not always be able to socially distance, is the mask a really good shield in that situation?
Absolutely. And I think you'll see, as we learned last year, initially we were quite conservative with the 6 feet, but you saw the CDC made a recommendation allowing it down to 3 feet because we recognized that we were quarantining hosts of classrooms. I don't want to say unnecessarily, but it might not have been necessary given what we've learned about it. That being said, the masking, I think, is the most important thing there, as opposed to some of these other factors like the exact distancing.
Okay, that's good to hear, because there's a lot of concern around transportation and busing. And what would you say about buses?
I think we've looked at that, and I think we're comfortable having folks sit on the bus. We've asked transportation companies to keep a seat chart, so to speak, and when possible to ride with windows down, but that's a generally brief period of time, and we're confident that if the students remain masked, which I recognize might be operationally challenging, that the chance for disease spread should be minimized.
Great. Okay. And we did have a question come in around asking around whether you can actually harm your immune system by keeping a mask on all day. Is there any danger in that?
No, I've not seen any data on that. And again, for many adults I know for the past year, as this academic calendar ended, a lot of them came up to me and said, hey, I had the healthiest school year ever. I didn't get sick at all. Regardless of what happens with COVID, I'm going to continue to wear a mask because I didn't get sick. So no, there's no damage to the immune system.
Great. And then the minimum age a person or a child can wear a mask is age 2.
Yeah, the recommendation is that try it for ages 2 and up. I recognize that in the preschool environment, this is challenging. And I think in the state of Louisiana, we've allowed sort of those pre-kindergarten schools or daycares to have the ability to have some latitude in providing oversight for that.
Okay.
Meredith, did you have a comment on that? I saw you just popped up.
I did want to suggest that parents and school systems use our resources that we have available to encourage our kids to wear their mask appropriately and properly. And I think that is one way that I see some concerns in the chat about whether students will wear them appropriately and whether they will be well-fitting. And I think that's something that parents in our school systems and teachers can teach, much like they do many other procedures throughout the school day. So we have resources available through Children's Hospital and through the CDC on appropriate mask wearing. So I think that's something that our school system should definitely be utilizing.
Great, thanks, Meredith. Tiffany and Daphne, if either one of you have any comments around masks that you'd like to share, I'll go ahead and switch off the topic if not.
Yeah, I would just add that our children are doing a wonderful job all the way up from pre-K through 12th grade. But also our teachers and staff are doing their best to model the masking. We have signage throughout the schools to demonstrate proper masking, and just encouraging that, modeling that not only during school, but parents at home as well. That helps to facilitate what they do during the school day as well. So every little bit counts. It takes a village.
That is true. Thanks, Daphne. Okay, so switching over to testing, there's been some community questions coming up around just turnaround time for results, where to go for testing. And I will just reemphasize that the Children's Hospital New Orleans hotline, that ThriveKids hotline, is a great resource to call. If it's not an LCMC facility, they can guide you to one near you. So please reach out to that. That's 504-837-7760. And then Dr. Finger, what are your thoughts around testing resources and inventory actually fluctuating in the community and how that may impact our expectations for turnaround time?
I think this is different across the entire state, but right now those molecular tests that have a turnaround time of 30 to 60 minutes are really reserved for patients in the hospital. So I've spoken about this with our partners at the Office of Public Health, knowing that those recommended tests might not be a molecular test, which we fully understand. But if there's a school system that's going to use a test for a option to decrease duration of quarantine, it certainly has to be a molecular test. So I think you need to work with what your local resources are, which are variable and increasing each day.
Okay, great, thank you. And I'm going to go ahead for this next question, go toward our decision tree. As far as getting a COVID-19 test, whether it's symptomatic or a close contact, there has been concern for not being able to be scheduled right away the first moment you find out you should get a test. What would you advise to both parents and school staff members if they find themselves in a situation like that, where the next available appointment is maybe in a couple of days or the next afternoon?
That's completely okay. So if they're symptomatic, they obviously should be returning to the campus regardless. And if they're not, they either fall into the you must quarantine bucket anyway, or they can continue to be on the campus of their school while they wait to get tested, because there's not a requirement to quarantine. So that's okay. Okay,
great. That's helpful. Thank you. And can you maybe just talk about why it's so effective to test on the first day, if possible, if medically, if the opportunity is there, as well as again on between day 5 and 7? There seems to be some confusion around that.
This is a recommendation from the State Office of Public Health. And again, it's not the first day, but again, in the first couple of days after the notification of that, while you're in that quarantine period, in an effort to identify someone who might be asymptomatic and potentially positive. We don't know exactly what that number might be, but we know that if we test people more than once, our likelihood of identifying more people and that therefore keeping more people in the community safe is amplified. There's more to follow on this since this recommendation really just started a couple of weeks ago. Okay,
great. Thank you. And I did see a question come up around where to access this decision tree. This is posted on the New Orleans, the Children's Hospital New Orleans website underneath the ThriveKids COVID-19 section. But there is also a nuanced version depending on the school district that you may work at or that your child may go to school at. So I would just keep that in mind and just look at your school's resources and reach out to them for questions as well. Meredith, did you have anything that you wanted to share as well?
I did. I wanted to point out that this decision tree is also found on LouisianaBelieves.com under our pandemic relief library. And I did want to take the opportunity to address some of the questions regarding how have we adjusted our guidance in light of the new Delta variant. And I think Dr. Finger could agree with me that over the last year, we have been extremely reactive to any changes that have happened with the COVID situation. And we have adjusted our guidance sometimes 3 or 4 times a week based upon the latest medical advice from our medical experts. So that is something that we are constantly monitoring and constantly updating. Like I said, weekly, sometimes multiple times a week. So that is the partnership that we've established with Children's Hospital and with the Department of Health has given us the flexibility to be able to change our guidance as needed to respond to what's happening within the state surrounding COVID and the pandemic. So I did want to acknowledge that, there are concerns, but we are addressing them as they come up.
A great point. Thanks, Meredith. Yeah, if you see anything else, feel free to continue to jump in, Meredith, Tiffany, and Daphne. All right, so those are all of our questions so far around masking. Again, we'll revisit the chat and make sure that we're not missing anything there. But just so far as just to talk about precautions in general, do you have any suggestions on what precautions families can take or staff members can take if they do have to travel as an adult? And then what if they have to travel with young children? Is there anything that they should do differently?
They should do everything they're doing in their own community when they travel. So I think as long as they mask and while they're traveling amongst the public, I think that's completely safe. I think there was anxiety about that very early on in the pandemic. But again, now, as long as you mask while you do that, the risk is minimal.
Okay. What if the child or the individual cannot mask reliably, either because of the age or because of a chronic condition or a disability? Would you have any advice for how to navigate that differently if that's the case?
I think that's the same as how they navigate it in their normal environment. So.
Okay. And then we did have a really good question come in around a family that has, a school-age child that is able to take precautions successfully, but also has a newborn at home. Is there anything that those families should keep in mind if they have that kind of age gap between their children?
Yeah, no, I think the biggest thing a family like that can do is the parents should be vaccinated when they're eligible to, right, over the age of 12, and then practicing these safe practices when they and their school-age child are out in public. I think the school day is one part of your life, but those precautions extend to every other area of our life about masking indoors, et cetera. So I think being uniform in our application of these health safety measures in all parts of our activities of daily living is important to ensure the safety of that newborn.
Great. Tiffany, is there anything you wanted to jump in with?
Yeah, there were just a couple of questions referencing that NOLA Public Schools had some additional precautions than other school districts. And I just kind of wanted to discuss why we made some of the decisions we made around our close contact definition and our quarantine of 14 days. So as part of our commitment to in-person learning, part of that is making sure that our system and our schools can stay open, which really is about reducing cross transmission in our schools. So when we have a positive case, ensuring that we are taking the actions necessary, especially for a more contagious variant, to ensure that we stop that in its tracks. Because, you know, though we understand how incredibly disruptive it is to a family to have your classroom quarantine or your students' classroom quarantine, what we're trying to prevent is a whole school closure due to cross transmission of disease. And so that's why we and our medical advisors made the choice to have the original 14-day quarantine, as we found it was more protective against a more contagious variant, and also using the original close contact definition of 6 feet, not 3 feet, again, because of the more contagious nature of this variant, because our goal is in-person learning for all. And that might mean some students have short-term quarantines so we can keep the whole system running. And so that's just our rationale for some of our increased mitigation measures. And I just wanted to share that with the parents.
Thank you, Tiffany. We did have some great questions also come up around flu shots. And so I just want to circle back on that, Dr. Finger, along with our vaccine comments that you made. Do you have to wait a certain amount of time after getting a COVID-19 vaccine in order to get a flu shot, or vice versa?
You know, those have varied. I don't know if Dr. Jackson wants to answer that as someone who's practicing in the general pediatrics community, and how the general pediatricians are following that and other primary care providers are following that locally in the community. Is she on? We can come back to that.
Sure. Yeah, we can come back to that. We have Dr. Jackson on. She's our medical director of primary care and is also medical director for Jefferson Parish Schools, and can comment on that whenever she's ready to.
Kimberly, I am here. I was taking the obligatory Zoom a moment to unmute myself. Yes, we do recommend the flu shot. Once we get into flu season, typically we start that in around the October timeframe for the winter season and the flu season. So once our pediatricians will have those immunizations within the clinics, we do recommend that students, parents, everyone anyone over 6 months of age will get both of those shots, both the flu shot for 6 months and up and the COVID shot, which hopefully by that point we will have indications for ages 5 and up. So I hope that answers the question.
Awesome. Thanks, Dr. Jackson. Appreciate you jumping in. Okay, and then we have I'm assuming there's school leaders that have reached out with these questions, just kind of looking to how to manage the classroom and manage the facility of school campus. And so there's been a lot of questions around ventilation and whether if there's a way to actually measure how COVID-19 how that transmission is taking place indoors. Dr. Finger, is there any way to measure that? Is there a carbon dioxide concentration is a good proxy for the associated COVID transmission rate, or anything like that school leaders can pay attention to?
I'm not sure I understand the question exactly, Kimberly, but I would say that an inadequately ventilated small closed room environment certainly could be a nidus for heightened transmission if someone in that room has active COVID-19 and is not wearing a mask. But other than that, I don't really understand the exact.
Yeah, I'll restate that. Sorry if that was confusing.
I don't think we need I don't think there's a actual study that says that there's any level of actual ventilation that correlates with the spread of COVID-19.
Great. What about temperature? Do you have to keep the thermostat at a certain degree in order to help transmission rates? Okay. There we go. Thank you. And then facility management, as far as cleaning goes, do you have any thoughts off the cuff for high yield activities versus low yield, and what teachers and schools and facilities management should really be investing in?
Yep. I don't want to tell any schools not to clean their campuses, but I think focusing on cleaning a doorknob every hour, like some of the early recommendations were, is probably not a high yield activity. So I think cleaning the bathrooms more than once a day is not unreasonable, but probably don't need to spray down the playground equipment in between every set of kids who play on it.
Okay, great. Thank you. All right, well, I'm going to go ahead and take a moment to just review the chat and see what unique questions have come up. Dr. Finger, is there anything that you'd like to spend a few moments just elaborating on that we haven't gotten to yet around masking, vaccination, social distancing, or any other precautions?
I saw there was one question about the exact wearing of the mask, and I think if most of the kids and most of the educators are wearing the mask mostly correctly, that's what we need to aim for. There's never going to be a perfect seal on the nose and around the cheeks for every single person on a school campus, but we need to aim to be directionally correct. And I think most of the kids that I've seen are aware of this. I think we also have some latitude to have folks outside be unmasked. I saw that question in the chat, and I think schools are determining how to operationalize that in the most effective and sort of with the most amount of oversight manner.
Great, thank you. That's an excellent mask as well, by the way. All right. So if anybody else has any questions, I'm just going to give it a few seconds for you to submit them into the chat. If any of our panelists have anything that they'd like to take a moment to share as well, I'll give them the floor while we review these questions.
Kimberly, I saw a couple other questions about temperature checks at the door and also eating in cafeterias versus classrooms. So we are not having temperature checks at our front doors like we did last year. This is based on the guidance from LDOE, or Department of Education. But we are really requesting that our families are doing temperature and just symptom checks before they send their students to school every day, as we know that there are many symptoms of Delta. And Dr. Finger, I think it might be worth going over what the symptoms are, because I think sometimes it's surprising to folks just how seemingly minor some of those symptoms might be. But we think it's incredibly important for our families to do symptom checks with their students before we send kids home. You know, of the cases that we reported on Monday that in our active school system, though it was 299 that we reported on Monday, a third of those were cases that our families identified by not even sending their kids to school, where they had a student with some symptoms, they went and got them tested, didn't bring them to school, and those students were never even on our campus. And I think that just speaks to our families taking this very seriously and committed to the learning of their children. And we need more of that. So I think that's incredibly important. Also, you know, dining in cafeterias. At NOLA Public Schools, we've restricted the use of our indoor assembly spaces for the start of the school year. So we are not eating in cafeterias, except for in some instances where schools have committed to provide operational plans of using less than 25% of the seating capacity of their cafeterias. So again, another step where we're going above and beyond some of the state level guidance. As we think we just don't want to, again, we're trying to manage quarantines and not having large groups of people in high risk activities together, like eating. So that's one of the additional restrictions that we're seeing in NOLA Public Schools.
Kimberly, I see there's a question about kids in athletics. Is there a requirement to be vaccinated? I know that the LHSAA, which is a separate organization, has made a recommendation on either vaccination or frequent testing. I wonder if either Tiffany or Daphne might know more details about that, since that's out of my purview, but I know that that's a recent recommendation that they made to participate in those type of extracurricular activities.
I can speak to that a little bit, Dr. Finger. As far as athletes are concerned in Jefferson Parish, we are following the 10-day quarantine period for them to return to school. However, the student athlete would not be able to return to practice or play for 14 days. And if the student tests positive for COVID, there is a return to play criteria, which means it takes a little bit longer. They have to go through a 4 or 5 step criteria before they can fully return to play, which includes an EKG and a thorough examination by the doctor. And that's because they have a longer quarantine to return to play because of the close contact and unmasking during those practices and plays.
And then for NOLA Public Schools, our high schools have really banded together, and they have submitted to the district that they will require vaccinations or weekly molecular tests for any student participating in extracurricular activities like athletics, and like band. We know that those activities are higher risk. They were a source of a lot of our quarantines last year. So our high schools will be implementing that. Again, we'll be supporting them with making sure that they have weekly available testing. I did see somewhere in the chat that somebody was saying the resources that we have available for students were just for those 12 years and up. Obviously, that's for vaccinations because they're the only ones that are eligible, but our testing program is for everyone, pre-K to 12. So they're at all schools, and that will be available. So we really commend our high schools for going above and beyond. Also at NOLA Public Schools, we are mandating the vaccine for our staff. Well, our staff are currently 80% vaccinated at NOLA Public Schools, but we are mandating it. And our charter management organizations are also starting to mandate for their staff as well. Also, we will be posting the vaccination rates of our students and our staff on our COVID-19 tracker starting at some point in September, once we're able to collect and verify that data, so families can have a little bit more information about the vaccine status of those in their schools.
Thanks, Tiffany. Dr. Finger, I did see a couple questions pop up that we answered at the very beginning when we were going over the COVID-19 update. Can you talk about the Delta variant and how those symptoms are or are not different than last year's dominant strain?
Yeah, so they can, the symptoms are mostly consistent with what you might see in many other viruses, sort of a stuffy nose, mild cough, fever, headache, fatigue. Something that we're not seeing as much of now that we saw with other variants of COVID-19 are GI symptoms like vomiting and diarrhea. So those are slightly less common now than they were with other variants. But the broad constellation of symptoms can trick many people into thinking, oh, it's not COVID, I just feel like this. And the classic symptom of loss in taste and smell. So, it's something that can mimic many other diseases, which is why we strongly recommend getting evaluated and or getting a COVID-19 test if you have any of those degree of symptoms. So apologize if that didn't get answered. And I saw someone asked about hospital capacity. I know that there's lots in the news right now about our beds and how many beds we have available. Here at Children's Hospital, we certainly have capacity to accommodate children who need our care from the greater metropolitan area and all over Louisiana and the entire Gulf Coast.
Great, thanks, Dr. Finger. We also had several parents discuss concerns around chronic conditions. And I know that came up a lot last year during the school year. Can you just talk about how taking precautions may be different or not different for kids that have asthma or diabetes or specific chronic conditions that they have to take care of during the school day?
Is the question how they can be kept safe at school or how they can be kept safe at home, Kimberly?
That's not specified. Maybe we could talk a little bit about both.
Yeah, I mean, I think those parents are usually well aware of how to treat their child who has a chronic medical condition. So I think all the precautions that they take, they should continue those, and making sure that their school nurse or school operational leadership is aware of the disease that their child has or whatever they suffer from, so they can be sort of have enhanced levels of communication about what's going on the school campus.
Okay, great. And then Tiffany, I saw you just pop up. I'll let you make a comment.
Yeah, I saw one question about mitigating COVID-19, especially with students with special education needs, especially if they're unable to wear a mask successfully at all times. What we definitely see in our special contained classrooms for special education students that our schools do is they really limit the interaction of adults and students with those who have special needs or are unable to wear masks successfully all the time because of any kind of other sensory issues or other issues. And so what we see our schools use to mitigate that risk is really limit exposure to other individuals and having really, really small static groups. So there's very few people interacting in those classrooms. And so that's kind of just wanted to share that is the technique that most of our schools are employing.
Kimberly, I've seen a couple of questions on how best to sort of deal with a student who is declared a close contact, or if they how to treat them at home. If they're a close contact, they need to quarantine. But I don't think, unless they develop symptoms, that you need to keep that quarantine child necessarily away from every other kid or person in the house, depending on the age of the child. A teenager might be quite comfortable quarantining by themselves away from the rest of the family. But obviously, the younger a child is not going to be able to effectively quarantine from everyone else in the house. So I think it's age appropriate, it's hard, and it's disruptive. And many of us have had to do that over the last 18 months. There's not a perfect answer for that, but I think what I've seen be successful is people be flexible in their own household and do what the age of the close contact allows you to do.
And circling back to masking, as far as physical activity goes, do students or even adults need to have a mask on while they're working out or while they're at recess? Can that be a concern? What would you advise for wearing that mask?
I think our approach has been that outdoors it's okay to be unmasked. We've seen that, and that's our recommendation right now, Kimberly.
Yeah, and I go a step further that's saying LHSAA, which is the organization that manages our high school athletics, they actually updated their guidance for fall 2021 sports and also stated that indoor practices and indoor sports individuals should also be wearing masks, except for those who are swimming. So just wanted to share that as well.
Okay, so it seems like we've covered a lot of these medical questions, and I think we're getting to the bottom of our list here. So if any of the panelists have any extra comments or seen any questions we haven't reached that they would like to elaborate on, please feel free to do so. If not, we'll go ahead and take the next few minutes to kind of wind down the town hall. So I just encourage everyone to get their thoughts in.
Kimberly, I did see a question about why we are approaching this year slightly different, like why we are returning to school with having everyone come back to school for in-person learning, and why is that different from last year? And Lee and Dr. Finger, I believe you answered this question previously, and well, we continue to learn as this pandemic continues. We are seeing data and we're learning more and more, and that's why our recommendations are evolving, as is the Delta variant. So, we were able to see that we could decrease the distance, the safe distance between students from 6 feet to 3 feet. So that allows more kids to return to school. And it's important for the kids to return to school so they do have that in-person learning. And I'll leave that to the educational experts to comment on that. But as a mom, I know it's very important for my kids to return to school and to learn in person. And I want them to do that as safely as possible, which they are. Fortunately, my kids are over 12, so they're vaccinated and they're masked. But, we are changing those recommendations to reflect the most up-to-date data and information that we have and what we've experienced. So I welcome the other panelists to comment on that as well.
Yeah, absolutely. Thanks for bringing that up, Dr. Jackson. It's our position at the Department of Education that whether it's in-person learning or another type of learning is up to each individual family. However, I think that we learned over the last year that it's not only important for our students' academics to be in person, but also for their social and emotional well-being, for them to be in a classroom with their peers and interacting on that level. I too, Dr. Jackson, am a mother of 2, and I know that my children did experience a greater learning capacity when they were in their classroom versus when they were doing virtual. So our position is that we are going to partner with our medical experts, and we are going to put forth the guidance that we think will help us reach that goal in the safest way possible. But we also respect the personal right of every family to make the choice that is best for them.
Thanks, Meredith. I did see a couple of last-minute questions come into the chat regarding the type of test that's required in order to shorten close contact quarantine to 7 days according to this decision tree that we have up. Dr. Finger, do you want to comment on that before we wrap it up?
In those school districts that are using that option to potentially shorten duration of quarantine to 7 or 10 days, that test needs to be a molecular test.
Great, thank you. And I think that was about it. So Thank you everyone for joining us today. We greatly appreciate your time. And for all of our panelists, we're just grateful to be able to collaborate with you and to come together as a community and the better interest of our frontline healthcare workers, educators, and kids that are out there. So we appreciate everything that you're all doing. And thank you for everyone that tuned in. If there's not any other closing comments, we'll go ahead and wrap it up. Otherwise, I will give it just another minute and then we'll go ahead and close it down. Thank you, everyone.
Thanks so much for the partnership, Kimberly and Dr. Finger.
Thanks, Meredith.